Heart valve replacement surgery involves removing a damaged heart valve and replacing it with a new one, either mechanical or biological. This procedure is typically performed when valve repair is not possible or when a valve's condition has significantly worsened. Types of valves. Mechanical valves. These are durable, long-lasting artificial valves made of materials like titanium and carbon. They often require lifelong blood-thinning medication to prevent clots. Biological valves. These are made from animal tissue, pig or cow or human tissue. They don't require lifelong blood thinners, but they may need replacement at some point due to wear and tear. A traditional approach involves making a cut in the breastbone to expose the heart. The heart is stopped and put on a heart-lung bypass machine while the surgeon removes the damaged valve and replaces it. A smaller incision is made, and a catheter is used to guide the new valve into place. This method is often used for transcatheter aortic valve replacement, TAVR. Hospital stay can range from a few days to a week. Patients are typically discharged within a week, although the recovery period can last longer. Cardiac rehabilitation programs can help patients regain strength and endurance. Blood clots are a risk with mechanical valves requiring lifelong blood thinners. Infection is a possibility with any surgery. Bleeding, while rare, can occur during or after surgery. Heart valve replacement can significantly improve symptoms like shortness of breath, fatigue, and chest pain. It can also prolong life and improve quality of life for individuals with heart valve disease.